So for many of us, our coast is a source of pleasure, fond memories and hope, which is wonderful. But while it's good to reflect on the positives of the coast, it's also prudent to have a degree of balance, acknowledging that there are some serious health concerns and challenges associated with our coastal communities, as clearly articulated by the 2021 CMO report, Chief Medical Officer report on coastal health. Health inequalities, as we know, refers to the avoidable differences in health outcomes between different groups and is driven by social, economic and environmental factors. In coastal places like Hastings and Rother, these inequalities manifest as a shorter life expectancy and fewer years lived in good health compared to more affluent areas. On average, residents who live in non-coastal communities enjoy 10 years of extra life and can expect to spend an extra 20 years in good health compared to their coastal counterparts. In East Sussex, we very much recognise the contribution of the arts, culture and creativity and have done so for a number of years. Since 2021, we have journeyed towards becoming a creative health county and are now working towards embedding our learning into our neighbourhood aspirations. Research, as I'm sure many of us will agree, is fundamental to tackling health inequalities because it provides the evidence base for action. It helps us to identify where disparities exist and understand the underlying causes and evaluates which interventions work best. Research amplifies the voices of those most affected, ensuring that policy and programmes are informed by real experiences rather than assumptions. In coastal communities like Hastings and Rother, research enables us to design targeted solutions, integrate creative approaches and measure impact over time, turning this into meaningful change. East Sussex County Council is therefore proud to be part of the Coastal Community Creative Health Research Project. This is a 3-year project funded by the Arts and Humanities Research Council. It focuses on 3 coastal areas in England: Hastings, Weston-super-Mare and Blackpool, all of which have health outcomes that are poor, while are all rich in cultural and creative heritage. Using the building blocks of health framework, we have framed the local narrative that arts and culture can mitigate against the difficulties in accessing these building blocks, or indeed strengthen their use. We know that when these building blocks are weak or inaccessible, people face higher risks in terms of chronic illness and reduced well-being. We know that the key ingredients to our success as a neighbourhood place going forwards will be our ability to build on our learning to date, our established relationships with our communities, our commitment to research, data, evaluation and innovation, and our track record of developing strong partnerships with the local authority, NHS, academia and VCSE. Thank you.